Hello, and welcome to MassageTherapyRadio.com.
Welcome to MassageTherapyRadio.com. We're at the 2007 AMTA National Convention in Cincinnati, Ohio. I have the pleasure of being joined today by Jamie Bernardo and Mary Contreras of Touch of Relief. Thank you very much to two of you for
talking
with us today, taking time out of your busy schedule and that. I understand you're very busy. Can you explain to our listeners what Touch of Relief is and how it started?
Well, Touch of Relief is a nonprofit organization started in January of this year, actually. And it was out of a growing need to take our idea and our passion to be of service to special populations, especially populations that have a great need for massage but don't have necessarily the access, whether it's having the information or having the knowledge to go to get that work, or to even know that that work is good for what they're going through, or it could be just a purely financial reason. And in our experience through working with a school where we teach, Potomac Massage Training Institute in Washington, D.C., we've done a lot of community outreach work. That's actually what we used to do together for the school. And through that work, we found such a great need for different types of people to be introduced to massage therapy. And we just got drawn to it. And one of the programs that really, actually two programs through the school that we worked with that got us to thinking about starting an organization where we could spread that service out to folks, is working with injured soldiers and their families, rehabilitating at Walter Reed Army Medical Center in Washington, D.C. Most of these folks are coming straight off a theater of war in Iraq or Afghanistan. Working with those folks has been an incredibly rewarding experience for us. And we found through that experience that there was so much need for the work that we do, yet there was hardly anything out there that we saw that was addressing that need. And we were only in one place. And once we found out that these folks are coming in back to the States and they're just spreading out all over the country, either where they live or where they're stationed, and getting the medical attention that they need, but not necessarily the complete rehabilitation, the healing process that they really and truly need and desire, we felt that it was something where we needed to come up with a process for us to go out and recruit other folks who would like to work with that population and meet that need. The other program that we've been working with is through doing disaster relief work, especially down in New Orleans in Mississippi, and we've been down there a number of times working with volunteer organizations who've dedicated months and years out of their lives to go down and volunteer. So championing their cause and working with them because of the physical work that they've been doing to try to rebuild that area, and also the disaster victims, and not only the physical but the emotional trauma that they've gone through in that whole process. And so those two things have really given us an inspiration to start an organization where we could just be a clearinghouse for folks, massage therapists, who really yearn to be of service, especially all the kind of the climate that we're in, wanting to be of service but not necessarily knowing where to go or how to organize an event or a program. And so we felt like that was a need that wasn't met, and that we could start something at least to get people to really find an avenue to try to meet that need and to work with those special populations.
We were talking earlier about an additional project that you're doing with abused children and mothers. Can you talk more about that with us? Well,
we recently got a grant from a private family foundation called the Palmer Foundation out of Wisconsin, and it's a year-long grant where we are planning to establish a curriculum of workshops and education workshops and trainings for domestic violence survivors, mainly young women with children, and they are being assisted by and living in shelters, transitional shelters, provided by a lot of really great community service organizations in Washington, D.C. And we've been actually pounding the pavement in recent months to try to get a collective of these shelters. Some are religious-based, some have been around for a long time providing health care and other assistance to this population that really needs support in order to get it back on their feet, essentially start a new life, and then make sure that their kids are taken care of. And we're in the process of partnering with some of these organizations and providing weekly workshops, with the main theme being introducing and educating them on positive touch, as opposed to all the negative touch they've been experiencing that they're used to, especially getting the kids early enough where they can turn those memories, those bad experiences and memories, into good ones, and how the mothers can support them and be connected through touch with their kids. So there's a lot of stuff that we're still trying to learn about that special population and what we can do for them, but the opportunities seem enormous, not only for massage therapy, but also other CAM therapies. So we are envisioning working with and recruiting CAM therapy providers who can touch this population and be a positive impact for their healing process.
I'm so happy that I got to meet the two of you today, and I'm so happy that we were able to bring this to our listeners of Massage Therapy Radio. You started this organization. You're working with veterans. You're working with abused children and mothers. There's the two of you. You have you're doing all this stuff. You're recruiting therapists. What do you need from the massage therapy public? It sounds to me like you need massage therapists, but you also need massage therapists. They don't have to be doing therapy. They could volunteer in other ways to deliver other services for you. Can you talk about that?
Yes, actually, that is our two-pronged approach. Is certainly needing the bodies, needing the folks who have the passion to work with these populations. And we started locally, but quickly we've found the need everywhere. And so we are working with states like Texas and California, and now here in Ohio, because we're here, and there is a large VA center here, medical center here. We're looking for therapists who in these areas can provide that specific work to these special populations. And the other piece is the administrative piece, which you mentioned, which we're trying to do locally with our folks, our community in the Washington, D.C. area of massage therapists to help us do the administrative and logistical pieces of getting these things up and running, and then maintaining them and maintaining a support system for the therapists out there who are on the ground working in these places, because we're supporting them off-site. So we're going to need that administrative structure in place. And that means, in these places, having both of those pieces. So looking for both of those kinds of people who are interested in volunteering on both ends of that spectrum.
Well, Mary and Jamie, it's been such a pleasure to sit here and talk with you.
Thank you very much.
It's one of the highlights of coming to the 2007 convention. I can't wait. I'm going to see you next year.
Absolutely.
You're going to have an army of people out there doing all this work, volunteering, and that. And it was just fantastic having you today joining us on MassageTherapyRadio.com.
Thanks,
and I'd like to thank everybody who listened to our broadcast today at the 2007 AMTA National Convention in Cincinnati, Ohio.